Review annually. Plan for what courses you need to take and when. Practice the big tests, the SAT or the ACT. Plan for extracurriculars and plan.
So you take the SAT or pre-SAT, SAT as early as possible, and then you make sure you do that to get the score that you really want to submit to a college for entrance. Start taking all the maths and sciences that you can take. If foreign language is available in high school, you want to make sure you take that and develop a long-term career plan so that you can start early at looking at various things that you may find yourself interested in.
You can use any...
Some schools can give you a head start with specialized health occupations classes.
I introduce them to a variety of health careers, and right there they see the educational requirements, the roles and responsibilities, and they also see how much money they could be making, because that can also be an attraction for very young kids, you know. Yeah.
For old kids too.
Essie completed this health occupations curriculum with a career ladder approach to accomplishing her training in healthcare.
Good. See that? Very good. Do we have any more questions on that? It doesn't necessarily have... One of my students started out in my program, the Health Occupations program. She was a highly motivated and very, very dedicated, hard worker. She started as a nursing assistant. Then she went on to the community college where she did the phlebotomy program.
I worked full-time each time I went to school. When I went to LPN school, I was a phlebotomist. I love drawing blood. Red is my favorite color. And became very good at it. I had to be at work at 4 o'clock in the morning, work from 6 until 6 o'clock. Then I left work and went to Durham Tech, the school. Worked all day, got out about 4. Came back to work, worked from like 5 until 9:30, went home to take care of my mom, and then started everything all over again for the week. And then I worked 10 hours on the weekend. And I went back to nursing school in the summer of '94. Some of the books I wasn't able to get at the time, so I went through almost the whole class without a book, but I paid attention in class and just made copies from other students. So I had to improvise, be a little creative. So, and it worked. I finished in May of '95 and obtained my RN grade. Took my boards, and you know, it's a breeze.
Creativity, determination, hard work, support from teachers, family, and friends were all important ingredients for Essie's success. There's also more help statewide for students, a whole cluster of health education resource centers called AHECs. Deborah Venable directs the Mountain AHEC's Health Careers Development.
There is an area health education center in every area of North Carolina that serves several counties. So each student could find out where their AHEC is and call that AHEC number and ask for the person who works in health careers. And that person, like me, is available to support these students in any way they need help, to come to the school and talk with them, to talk with the student and their parents. There are also manuals available in their schools. There's a health careers manual. That gives information on each specific health career area, where you go to school, what kinds of courses you have to take. We provide resources to help students get access to scholarship money, to financial aid. We also want to let you know that, sometimes it's hard for your parents, and we'll support your parents if they need some help. We have a lot of resources in North Carolina for students who are interested in health careers. The first place to start is in your school.
The AHECs can help you and help your family on the road to a health career and college. Special programs help too. Like this summer camp open to health career-minded middle and high school students. Summer or year-round programs enhance science and critical thinking and can offer students a closer look at areas of special interest.
One of my students last year was exposed to the medical school, where she was able to interact with the cadavers, and when she came back she was so excited about what she was able to do. That gives students an opportunity to really decide whether or not a health career is for them.
The AHECs work closely with another network of resources for students called NCHCAP, North Carolina Health Careers Access Programs. Sylvia Johnson runs the NCHCAP office at the University of North Carolina at Pembroke.
We have a clinical program, a summer clinical program that we encourage the students to participate in. I am able to have 8 students out in the summertime placed in various clinics locally where they can get the type of experience or exposure that's needed in order to decide whether they want to be in a health profession.
Not everyone can become a physician. There are over 200 health careers, but someone can find his or her niche in one of those.
Turn around and get you out of the middle of the hallway.
If you are a caring person and you like the idea of helping others, if you like options and variety and don't mind hard work, get involved. Explore a career in healthcare.
We have people who work with computers. We have people who fly helicopters. We have people who work in library systems. We have people who do graphic design and video work. You know, when we think about health careers, sometimes we think, well, I don't like blood and guts, and gee, I really don't want to be a doctor, and I don't want to be a nurse, and I want to give somebody a shot. But the cool thing about health careers is that, you know, your imagination can take you anywhere you want to go.
Healthcare is the most wonderful avenue in the world. There's so many things that you can do. I've worked at a pediatrician's office, I've worked at a dialysis unit, worked in a nursing home, did a little bit of private duty, small amount of home health, and now I'm a public health nurse.
Middle school is absolutely not too young to start. It's never too soon and it's never too late.
Never give up.
Study hard. Get good grades. Be determined. Set goals.
And only you can prevent you from getting there.
Look, if I could be a physician, you could be a physician.